Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain the angioid streak. An angioid streak is a full thickness break in calcified and thickened Brooks membrane with the disruption of the overlying retinal pigment epithelium.
Before we move on, it would be prudent to know the anatomy of the retina. The fovea and the macula have the highest concentration of cones, and the light that converges here is what makes up our central vision. Optic disc is on the nasal part of the retina, and this is the point of exit for all the ganglion cell axons from the retina. Ironically, the light converge here cannot be interpreted in the brain and thus forms a blind spot. Vessels of the retina, both the veins and the arteries, branch out from the optic disc and can be seen with the fundoscopy exam. There are a lot of different layers within the retina itself. Retinal nerve fiber layer contains the unmyelinated axons of the retinal ganglion cells. There are a lot of different nerve cells, such as ganglion, bipolar and horizontal cells, as interneurons, and sensory cells, known as photoreceptors. The plexiform layers contain the synapses between these cells and more, and retinal pigment epithelium is between the choroid and the photoreceptors and works to nourish the photoreceptors.
There are several factors that raise the risk of an individual having angioid streak. Some of them are listed in this slide, and so pseudoxanthoma elasticum are redundant skin folds in the neck, as shown in the bottom right picture there, and it is combined with GI bleeding and hypertension. Paget's disease is an abnormal extraskeletal calcification, and this can lead to osteoarthritis, deafness, vertigo, as well as increased serum ALP and urine calcium levels. It can even cause excruciating pain, as the foramen that hosts the passage of nerves may reform and impinge such nerves. Senile elastosis and calcinosis can also be risk factors, and the A-beta lipoproteinemia, which is an abnormality in the absorption of lipids, also form the part of the list here. Sickle cell disease and thalassemia and hereditary spherocytosis are blood disorders that can lead to anemia and can also affect the vasculature in the retina, leading to the angioid streak. Ehlers-Danlos syndrome, which is a connective tissue disease leading to blue sclera, hyperextendable joints, and elastic skin, to name a few of the symptoms, also raises the risk. Angioid streak can present as an asymptomatic condition. Some other individuals may have decreased vision or metamorphopsia if there is a choroidal neovascular membrane. Some signs that you may observe with someone with angioid streak is normal or decreased visual acuity, and upon performing a fundus exam, you may notice some linear and irregular, deep and dark red-brown streaks that's radiating from the optic disc in a spoke-like pattern, just like spokes on bicycle wheels. Prude orange retinal pigmentation may also be detected. Peripheral salmon spots and pigmentation around the streaks, as well as subretinal hemorrhage or fluid may also be seen, as demonstrated by the top right picture there. These are terms for retinal pathologies that's best learned by looking at different retinal pictures. We will soon link a Google Drive folder with the collection of such photos for practice. The following list of diseases can be the differential diagnosis of someone that presents with the symptoms and signs discussed previously. So that can include age-related macular degeneration, lacquer cracks, myopic degeneration, choroidal rupture and folds, hypertensive retinopathy that involves Segrist streaks, and ophthalmic artery occlusion. A complete ophthalmic history to rule out any other medical conditions, as well as the eye exam with the slit lamp, are prudent, and also use the Amsler grid as demonstrated on the right image for any possibilities of choroidal neovascular membranes. Investigations related to the angioid streak include the sickle cell preparation and hemoglobin electrophoresis, looking into the serum ALP and lead for any blood abnormalities, urine calcium for Paget's. Also check the stool guaiac and take a skin biopsy, and do a fluorescein angiogram for the eye, and this is to detect the choroidal neovascular membrane. If this is positive, you would see a granular pattern of hyperfluorescence along the track of the angioid streak. We would always treat any choroidal neovascular membrane as it could have adverse effects on vision. For that, we apply intravitreal anti-VEGF, for example, 1.25 milligrams of bevacizumab. We could also employ polycarbonate safety glasses to prevent any trauma, because this can cause hemorrhages or even choroidal ruptures. And as always, we try to detect and treat underlying medical conditions that contribute to the angioid streak. Prognosis of an angioid streak is good unless choroidal neovascularization develops. Here is a table with everything we talked about regarding angioid streak. And here is the reference slide for all the information that we've used. Thank you for watching this video.